Some bad news for our neighbors north on our world lead. Canada is now outpacing the United States in terms of coronavirus cases per capita. This is a concerning uptick, considering that the Canadian vaccine rollout is not going well at all. By comparison, in the U.S., more than 1 in 3 Americans have gotten at least their first shot. In Canada, fewer than 1 in 5 received their first shot. CNN's Paula Newton now finds out what's causing Canada's vaccine drought.
And that's hard to stomach. It's really hard to stomach.
Doctors frustrated, exhausted, as a growing third wave of COVID cases spreads across Canada, even more serious than the first two. And vaccines are arriving far too late to stem the surge. One horrifying look inside Canadian ICUs filled to capacity and beyond, and it's clear, doctors say, Canada's vaccine shortage is now their problem.
We went through a period where we were rapidly trying to immunize our healthcare workers, both first and second doses, to all of a sudden, we're not getting the supply that we thought we would. We have nothing. And it went down to, I remember weeks where there was no vaccine. Vaccines change the game of this pandemic.
And Canada is still on the losing end. For a country that had categorically claimed to have secured more doses per capita than any other in the world, doses have not arrived in time. And doctors say the early vaccine drought will cost lives. Prime Minister Justin Trudeau says Canada no longer has any domestic production capacity for vaccines, and unlike the US and the UK, was not able to ramp up domestic manufacturing. So Canadians are at the mercy of imports, not even from their American neighbor, but from Europe.
We continue our discussions with the American administration on getting more doses into Canada.
The Biden administration sent 1.5 million doses of the AstraZeneca vaccine to Canada in recent weeks, but there is no announced plan so far to send more. And from Europe, Canada has received more than 8 million total doses, all of it not enough for a country of nearly 38 million people, forcing most Canadians, including frontline workers, to get only 1 dose, with the second shot postponed as long as 4 months. That's prompted the head of the world-renowned University of Ottawa Heart Institute to plead with the Ontario government to quickly get a second dose to medical staff.
It's not a small problem, Paula. It's not a small problem. People are exhausted. We see staff not coming to work because they may have COVID. Are not so sick. They are not hospitalized, but they have symptoms. They stay home even with a potential 1 dose.
And the weeks ahead will be more gut-wrenching still. Many provinces are now locking down and triaging and transferring patients, activating surge capacity in its healthcare system that is now under threat of COVID-19 like never before. And Jake, look, this is a problem. You have to rewind decades to really get to the heart of this problem, but that doesn't let the Trudeau government off the hook. They've been in power for more than 5 years. They heard the dire predictions. This country for decades had a competitive advantage in making vaccines. The research was right here. But look, Canadians will now pay for that complacency. Trudeau promises that domestic manufacturing will ramp up next year. Jake, you and I both know it's just too late at this point in time. This third wave is punishing. I am speaking to doctors, especially in the hotspot of Toronto. You know, Jake, they are letting people into the sick children's hospital, adults, in order to be able to treat them for COVID. A lot of things to talk about here, including the fact that even though the dire predictions were there, no government acted for decades on the vaccine rollout.
Yeah, it's a real failure by the Trudeau government, and our Canadian cousins deserve a lot better. Paula, thank you so much for that. I appreciate your report.